As my time as a student right now, with experiences with the preceptors really have shaped my learning thus far in the clinical environment. I think you can only learn so much from like the books that we start with preclinical and the videos you watch just to learn and study for the tests that we take throughout our careers. But I think the real learning happens in the clinical environment. And I think it's imperative to have a preceptor there to be able to show you the right way how to interact with patients and how to properly diagnose patients and do physical exams and take histories. And it really does shape my education having a preceptor there to be able to guide me through all those things that I may not know yet. Without a preceptor, if I just showed up to a clinic, I would have no idea where to start. I feel like I would not be of much help to anyone. I would be very much lost in just the hecticness and craziness that is like part of medicine sometimes if you just let it get away from you. And I think the preceptors really help you reel back in to focus on what's important and how to best help the patient that's in front of you.
Especially in family medicine, we try to make it a lot more interactive. So we get the students in with the patient one-on-one. They're kind of the first point of contact, taking the history and doing the physical exam. And then, the goal is to be able to develop an assessment of the patient and present that to the preceptor. And then often we go back and see the patient together and review everything and then kind of debrief afterwards to make sure we covered everything, answered any questions. I learned as much from them as they do from me, I think, most of the time. And the students, they're always doing their rotations and up to date on the latest guidelines, practice recommendations. And they bring their experiences from different specialties into, primary care and family medicine. So I'm constantly learning too from them.
I think a message that I would share with somebody who is thinking about precepting is that it really does shape the student experience having preceptors there and having people who are invested in your learning. I think it really motivates you to be able to look at where they're at and strive to be there. When you look at them as a student, that's something that you aspire to be. And I think it really motivates students to be able to keep on going and pursue this as a career in medicine. I think it's very special in terms of a place and organization to be within and learn within. And I am very excited just to continue my education here.
Over the last couple years, we've made it really easy for docs to get involved, even with smaller segments of time. So it's really not that much of a time commitment. It's not a burden at all. I'm still able to do all my work, and it only really adds, not detracts.